So when we look at BTK inhibitors as a single agent, they're the most active, class of agents. Now, of course, trying to optimize these has been very important. We don't see with BTK inhibitor therapy complete remissions, which tells us that there are alternative pathways of survival, some of which we've defined, and I'm sure many others that we still have to sort of work on. But we don't see CRs, and this tells us we can do better. We've tried combining BTK inhibitors with BCL2 inhibitors. There's currently a trial that we're fully enrolled on combining pirtobrutinib with venetoclax. That's actually looking promising in the relapse refractory setting. When we tried to do this with ibrutinib, combining venetoclax and ibrutinib, we actually saw ventricular fibrillation, and we had to abandon that trial. So all these combinations are not going to be safe, and it is really important for our viewers to understand that. There's currently also a trial combining zanubrutinib with sonrotoclax. This is still proceeding, and so we're gonna learn about BCL2 combinations and perhaps integrate this sort of strategy into a fixed time limited therapy. But the ones right now, the trials that I would be looking at with great excitement are the combination of bendamustine Rituxan with BTK inhibitors. There's a trial in Canada, the BROM study, combining acalabrutinib with Benda-R that looks wonderful. We're seeing MRDs there. There's a trial in China that has just also concluded, combining zanubrutinib with bendamustine Rituxan. A lot of MRDs there too. We're very excited about that data. And in the US, we're doing a trial with zanubrutinib and Benda-R. These are slightly different trials because in the US, we're trying to minimize bendamustine Rituxan exposure, whereas the trials in China and in Canada are doing 6 cycles of bendamustine Rituxan. We'll see what the results are. We're actually over-enrolled on that trial, so we're really looking forward to presenting all this data. Actually will be presented in Palm Springs in October at the 13th International Workshop on Waldenström, so stay tuned, more to come.